Welcome to Wellness Teatime with Dr. Rita, your go-to podcast for all things mental health and well-being. I am Dr. Rita Sonko, and I am passionate about breaking the silence and the stigma surrounding mental health. In support of the Toli Wekka campaign, this podcast aims to increase awareness about the multifaceted nature of mental health and normalize conversations that promote understanding and support. Join me as we explore various topics, share real-life stories, and provide practical advice to help you achieve optimal well-being. Let's embark on this journey together because, remember, Toli Wekka, you're not alone. Welcome to Wellness Teatime with Dr. Rita. I have a very special guest here, Bishop Michael Kyazze. Bishop, welcome.
Thank you very much, Rita. It's indeed a pleasure to be on this cup of tea. I hope we will have enough
tea. Indeed. I was going to ask you, what tea are you having? So it's an online tea on my...
African tea.
Yeah, that is the best. Nothing beats our African tea. Yeah. So, Bishop, as you know, this podcast aims to inform listeners, viewers about different facets pertaining to mental health and to help them understand, first of all, of course, the concept, but also how different sectors or different professionals or different people who are concerned about it can get involved. So I'm quite excited to have you, Bishop, representing COPE Uganda. And I thought at the beginning, let us have you introduce yourself to our viewers so they can get to know you a bit better.
Thank you for the opportunity. Let me introduce myself, the most important bit of me. First and foremost, I'm Michael David Kyazze. I'm a pastor and founder of Omega International Ministries, which is a church with 40 branches in Uganda. And God has given me more responsibility and trusting me with the oversight of over 20,000 pastors, and this is under the organization we call the Confederation of Pentecostal and Evangelical Churches. I'm the general overseer, meaning overseeing all these churches in Uganda, which, as I said, is 20,000 people coming together to work together for the transformation of Uganda. Wow, I'm married to Christine. I have 4 kids. I call them kids, but they have grown up and they're out of the house. We are going through what we call the empty house syndrome, empty nest. And
empty nesters.
I'm excited at this time because really God is stirring my heart to work in the area of mental health.
Okay, so Bishop, thank you so much for your elaborate introduction. We've started Toli Wekka, as you know, and we're very excited about the partnership between COPE Uganda and Toli Wekka. And I wanted to maybe start there and just to help our viewers to understand what COPE Uganda's mission is, so that they can understand why COPE would partner with Toli Wekka. Yes, Bishop?
Yeah. Well, COPE is, as I told you in my introduction, COPE brings together religious leaders in different denominations together, and we try to work out solutions for nagging challenges in our community. And one of the areas we focused on this time is to help with health in Uganda. And in our bigger discussions coming together as leaders, we were alarmed to see the level of mental challenge in our nation. As you are aware, over 20%, 25% Ugandans are manifesting mental health challenges. And in one of the reports, we see that even young people who are below 18 are living close to clinical depression. So we sat down and we said we need to intervene. And the reality of the issue is that we realize that people who are mentally challenged and stretched or stressed do not seem to be able to find a psychologist, a psychiatrist in their neighborhood. And our conclusion, sadly, was that all of them do run to church and crowd church, but churches and places of worship do not seem to be aware of what to do to help those who are being plagued by these mental challenges. So we earmarked mental health as an area where we're going to commit ourselves to intervene, to help work with those practitioners, medical practitioners, to bring a difference in Uganda. I don't know whether that captures the heart of what brings COPE into the area of mental health.
Thank you very much, Bishop, for that response. My next question is about this issue of spiritual and mental health, the mix or the intersection between spiritual health and mental health. If we think about as human beings that we are talking about body, mind, and spirit, what do you see basically as the role of the church in fostering mental well-being, while at the same time, supporting people to attain a place of spiritual well-being as well? What do you see as the main role of the church in doing that?
Yeah, I think, how do I answer this? First of all, let me say that from my preamble, I have said that we have realized that most Africans, when they get into mental challenges, they would rather go to church or to their spiritual leaders to find solutions. And so I think church has been a place where they come to seek help, and we have not been aware. Or if we have been aware, we have not been well equipped to deal with the mental health challenges. Now, the fact is that in our training as theologians, we go through a certain training which trains us to psychologically deal with the emotional part of the believer. But we are more inclined to approach the challenges of people from a spiritual perspective. So we give spiritual support, a little bit of not well-informed emotional support, and then, of course, the physical support. So they're coming together with people who are trained more to do the mental, emotional support is giving church more power to help its parishioners to be more stable. And we have seen it not as a contradiction, but a way of empowering us to present ourselves in a more relevant way to people who are running to us with a problem which we are not fully equipped to deal with.
Certainly, professional approach to improve the way we manage the clients is very important. But I think, like you, in the analogy you gave before, I remember during the Toli Wekka launch, you talked about the deep end and the shallow end, the analogy of the swimming pool. And it is so true that obviously there are things that can be done on the shallow end, and the church really plays a very important role in that place. So when you think about that, then what are the main challenges? What are some of the key challenges that you're encountering when you're starting to create mental health awareness and the various initiatives that COPE Uganda is undertaking around mental health? What are the main challenges that you're facing in dealing with this?
First of all, we have the challenge of the increasingly overwhelming numbers of people who are being challenged mentally because of social challenges which are hitting our nation. Remember, we are a nation which, with all others, emerging from the COVID, we are in a post-COVID state, and we can assert that COVID did give us a backdrop to understand better how mentally stressed our communities are. We are having our people going through very economically stretching situations, and this has disrupted many domestic arrangements, and homes are breaking, children are growing fatherless and without parents. And so there's been that increased pressure. And with that increased pressure, given the statistics we have, it is an overwhelming number of people around us seeking this help, mental health assistance. So we teaming up with teams like Toli Wekka would help in this way, because now the people who come to us find us prepared to deal with what we have now understood as their major challenge. Coming together would help us equip our leaders who, as you said, what are my big challenges? Our leaders are not equipped. They are not informed. They cannot screen. They cannot ably refer those who are challenged. So we believe that working together would help us screen, know what kind of emotional challenges our people are having, and working with professionals, they would help us as the first referral before our people are referred to even bigger ways of, or deeper ways of being helped. So we have a need for capacity building, training. We need to explore different ways of therapies, because the most we can do is pray and share the word. But we need the information. We need the equipping to do the work better. Of course, it is now a national-wide campaign. We need a larger workforce. So training all the clergy, and here we are looking at those who are available in our hands are about 20,000 people who are saying, why don't you get us people to train us? We need the materials which they should use in training, that is training of trainers and training those who would help those in need. We need available professionals like you, Rita, coming over and giving us a real assessment of what's going on. We have different perspectives. We need with a better professional perspective. We think we can diagnose better and respond better, intervene better to the challenges around us.
Indeed, family issues are a big problem. So speaking about family, and indeed in many conversations that we've had recently, this has come up over and over around the issue of the difficulties in raising children because parents somehow have their own challenges and they are not available. So both parents and children are actually struggling. And a lot of the struggles that children face are in part due to gaps in our parenting. And of course, we know that a struggling parent is also not a very good parent in terms of their role as a parent. What can the church do in that space to foster or support or promote better parenting, supporting our people to become more intentional parents and address the gaps that we are seeing around this issue, which contribute to poor mental health for our young people?
Rita, the challenge of parenting is quite great in our circles. Remember, we clergy do support the falling in love. We do wed them. Then when they are wedded, they go produce children. Then we realize that a whole area of parenting becomes a huge challenge given the circumstances of different families and the challenges they are facing, sometimes financial, sometimes we have the drug challenges which are coming. We now have social media, which is flooding homes. You have a child at home, but yet they are outside because with their phone they can easily leave your house and go into another world. So there has been a stretching moment as we encounter parents having challenges with now grooming and bringing up their children in a more composed and orderly manner. So there is a challenge in parenting, and we think that we as clergy can be equipped to be even better parents with the knowledge that we may acquire from professionals who can help us understand what an impact of a fatherless family is having on the child, what domestic violence is doing to the child who's being brought up, what being homeless and not being in school, all dropping out of school, all early child pregnancies, all use of drugs, all viewing of things which are blasphemous, things which are vulgar and vulgar language, and how it's affecting our children in the communities today. So I think church can come out better working with professionals and developing curriculums and developing programs that can make our children interact better in the community, given their challenging parenting background.
Yeah, I suppose another important point is the fact that the clergy themselves are struggling, just like all the other people in their communities. They too are faced with many challenges of their own, economic, social, all the difficulties that come with living in a society where opportunities might be limited. And we always say, you cannot pour from what you don't have. A cup that is empty cannot, you don't have anything to pour into other people. What can we do around supporting the clergy also? Because they too are struggling, and it's very clear that we need to do much more to support them as well, so that they too can have opportunities to improve their own mental health. What do you see as some of the issues that we can tackle to make sure that there is some support that is provided?
Yeah, I think, Rita, as you properly put it, our observation, the sad observation, has been the realization that the clergy themselves are stressed because when you are dealing with something you cannot really size up, it also stretches you. The clergy are being hit in different ways because they are facing daily a spectrum of many challenges coming from their parishioners. That is illnesses, school terminations of children, deaths, paying of bills, many meetings, and the clergy themselves need help. And there is a program we would like to work with Toli Wekka to heal the healer, to attend to the clergy themselves. But also we are looking at equipping the clergy with enough information to be part of the intervention. Because as you said, nationally, we are seeing a problem, but we are not equipped enough to deal with the problem. And we do not really know how to size up and to strategize together to deal with the problem. For one, I would say we need to work together, not categorize that is for the mental health medical practitioners, that is for pastors, and that is for government. I think we need a collaboration. We intervene together, strategize together, share the resources we have together, then in a collective way, without despising each other, listen to what we are encountering and see where the real help or solution can spring from to help intervene effectively to those social pressures. I don't know whether I'm answering the question. It's a little bit bigger for me.
Our collaboration as Toli Wekka and COPE will obviously go some way further along in improving resources available and making sure that, as you have said, COPE has access to, gets access to these resources.
The areas where we have been needing strength and now as COPE have been purged, have been strengthened by our collaboration with Toli Wekka. Remember, working with Toli Wekka gives us more strength in a way that when we came together in this collaboration, we are seeing the wealth of experience you people have had in your social intervention in working globally and mainly in South Africa. And we were a bit perplexed as a beginning clergy. How shall we gain all the skill? Where shall we draw the power and information we need and the technical know-how to handle the huge task of training many leaders to be part of this intervention? When Toli Wekka came, we saw that we can work together as a team, first of all, in training, because you guys have already developed your material, which is very usable for training and can help us to begin training right away. Remember, we are just developing our training curriculum, and we hope to co-opt some of your staff to make it even more relevant for clergy in a clergy language. But that is already done. If we are together, our information, we don't have to start from scratch. We can work together to reduce stigma. And that is amazing because I saw you work with students here, and we have been looking at how we are going to approach church schools and schools which are affiliated to religious places. And we were wondering, how do we help students without over stigmatizing them? And we saw your approach as an amazing way of using interactive social emotional learning, where you brought games, you brought puzzles, And we saw that as a good alternative for us to find a way of breaking the ice, coming into the spheres of young people who would not like to be referred to as mentally challenged, but can be helped to get a platform where they can share what they are going through, where we can analyze as observing them going through your interactive learning and help them come out better. So we also shall be very empowered by your digital mental health tools. That was one thing we were thinking about. How are we ever going to be able to screen a whole nation? How are we going to do it with ease? But our cooperation together makes it easy because God has used you in a fantastic way to develop that digital tool, which I think will go a long way, help us establish even a better statistical position for what Uganda is going through.
Thank you so much for elaborating on the value of the partnership. And I'm so happy you brought up the issue of the social-emotional learning, which is a very important area for our young people, because this is one way definitely we can improve their mental well-being. And by being intentional in improving their social-emotional skills, we can actually do something before things get really bad for our children. To improve their resilience, social-emotional skills are really important. So the partnerships obviously need to look broader than just our two organizations. And I suppose looking ahead, what are some of your aspirations for this partnership?
I'm eager to work with Toli Wekka. I think Toli Wekka gave us platform to grow taller. It's a growth hormone program, and we are eager. We are eager. Remember, we come with a huge national network. Working with Toli Wekka is just making things easier, and we need all the help and support that our collaboration may bring the results that we are believing for.
It's clear we need to mobilize more widely to get different partners on board to support our vision, and certainly making sure that all these different people can come on board to support us will make us much more successful than what we can do as just our two organizations. Thank you so much, Bishop, for your support. It's been really fantastic, and we're so excited to partner with COPE. I believe that our partnership will generate new learning and enable many other partners to see what they can also do in support of the efforts that we're embarking on. I am very excited, and on behalf of my team at Toli Wekka, we are very excited to partner with you and looking forward to all the collaborations and all the learning, and just to see that we can make a contribution to improving the mental well-being of our people, and ultimately contribute to the country as a whole. Because when our people are doing well, the country does well as a whole. Thank you so much, Bishop. We really, really appreciate you and your team for all your support.
Glory to God. You can't believe how many people are waiting. The closing words, thank you for listening to us. There is an excitement, Rita, since we shared our collaboration and we went up country visiting some areas. People are on our door saying, "You guys, where are you?" And it's amazing when people are eagerly waiting for you to serve. May God bless you all. Thank you for the cup of tea, and may we have many tea moments and share what God is doing. God bless you.
Thank you. Thank you for tuning in to Wellness Teatime with Dr. Rita. I hope today's episode provided you with valuable insights and encouragement on your mental health journey. As we support the Toli Wekka campaign, let's continue to raise awareness and combat stigma by having open, honest conversations about mental health. Remember, you're not alone in this journey. If you found this episode helpful, please share it with others and subscribe for more inspiring and informative content. Until next time, take care and prioritize your mental well-being. Together, we can make a difference.